principal investigator for Nigeria. A prolific writer and researcher in nursing and healthcare, and a reviewer for many nursing and related journals in healthcare. Professor Edet has over 85 publications to her credit, which have been read by over 95,000 scholars all over the world, many of which are published in open access journals and high impact factor journals. Reports of Google Scholar citation of 8,165, Scopus citations of 382, an H index of 14, and I-10 index of 22. Those who belong to the academic community of University of Calabar would really appreciate this giant stride, which is akin to a camel passing through the eye of a needle. I drop my cap for you, Madam Professor. Yeah. Professor Olaide has won several grants, including the University of Calabar Senate Research Grant, the TED Fund Grant, and the Cross River State Nursing and Midwifery Research Grants. Distinguished ladies and gentlemen, the hallmark of success is mentorship, and Professor Edet has mentored many students and colleagues who have come in contact with her. She has examined several PhD and master's students' theses in community health nursing, maternal and child health nursing. Professor Edet is a member of national and international nursing organizations, including the Association for the Study of Standardized Nursing Languages, the National Association of Nigerian Nurses and Midwives, the University Graduate of Nursing Sciences Association, NANDA International, the Alpha Beta Gamma, a branch of Sigma Theta Tau International Honors Society of Nursing. This is the second largest organization of nursing in the world. She's also a member of the International Council of Nurses, where she belongs to the Research Network, the International Council of Nurses Education Network, International Network for Doctoral Education in Nursing, and Cochrane Nursing. As a seasoned academic and administrator, our inaugural lecturer has served as a leader on numerous prestigious boards and committees, and has received honors for her professional roles. Notably, among them are the board of the Nursing and Midwifery Council of Nigeria, Examination Committee, Standards and Accreditation Committee, and a lot of others. Locally, Professor Edet is also the coordinator and founding member of the Cross River State Nursing and Midwifery Research Foundation, which raises awareness of and promotes nursing and midwifery-led research for evidence-based policy development in nursing and healthcare. Ladies and gentlemen, a bit of her family life. Our inaugural lecturer is married to Dr. Edet, a renowned public health consultant. The union is blessed with 3 children. Among these are a general practice consultant, a professional nurse, great nurses, a professional nurse, and an engineer. Professor Olaide Edet has since, in March 2016, become a proud mother of granddaughters and grandsons. Madam Vice Chancellor, professors, members of the academia, our beloved students, ladies and gentlemen, it is my singular honor to introduce to this dignified gathering a God-fearing academic, a confident, self-motivated academic, a service-oriented public servant, a proactive and enterprising scholar, a widely traveled professional, a mentor, a leader, a quintessential teacher, daughter of Florence Nightingale. Please, with a standing ovation, can you please join me as we welcome this scholar, the inaugural lecturer for today, to the podium, Professor Olaide Bamidele Edet.
The Vice Chancellor and Chairman of the inaugural lecture, the Vice Chancellor, Professor Florence Vankobi, ably represented by the Deputy Vice Chancellor, Academic, the Acting Registrar, University of Calabar, the Chairman, Committee of Deans, members of my family, Malabite and Malabresi. Please permit me to stand on the already established protocol. This work is dedicated to you, the guiding force behind my existence, whose unwavering presence shapes my path. It's also dedicated to my parents, Mr. Unsu Olufemi Dada, acknowledged, yet leaving an indelible mark on the life they taught. May this lecture be a testament to your devotion and a tribute to the profound impact you have on our global community. I stand before us today with profound gratitude to Almighty God for enabling me to deliver the 131st inaugural lecture of our esteemed institution. It is indeed a great honor and privilege to have been granted this opportunity. I sincerely appreciate the 11th Vice Chancellor, the first female Vice Chancellor of our great university, for granting me this opportunity. I am filled with excitement and also with humility, recognizing that this moment is a testament to the goodness of God and to the support of countless individuals throughout my academic journey. A number of personal experiences have defined my life trajectory. First, as a young girl, I faced some health challenges that gave me a unique perspective on the importance of compassionate care. Later on, I witnessed my mother's hospitalization at a general hospital in Akure, where I was deeply impressed by the exceptional care that was provided by nurses and doctors. Their dedication and expertise and kindness left a lasting impact on me. This experience was later confirmed by me in my spirit, as the Bible tells us in Proverbs 20:27 that the spirit of man is the candle of the Lord. And I received an inward witness to go into this profession. The passion has led me to the UK and also to the Hadassah Medical Organization in the Middle East, where nurses are highly respected and very much valued. It also led me to Geneva in 2013, where I was exposed to leadership training. During that training, we were all asked, apart from your career, what else can you do? What else are you good at? And we were all encouraged that if it's only your career that you are good at, you need to pick another interest. And that was how the interest in getting into full-time ministry became nurtured. I would like to talk a little bit about my experience in the nursing department. So this passion also eventually brought me to Calabar. I started as lecturer 2 and rose through the ranks to become a professor of public community health nursing in 2017. So along this journey, I had the privilege of serving in various leadership roles, including acting head of department, deputy dean of Faculty of Allied Medical Sciences, and as the pioneer coordinator of the graduate nursing program. Currently, I'm the head of the unit in my department called Public Health Nursing. So these positions and experiences afforded me the opportunity to provide mentorship to undergraduate, postgraduate students, young academic, fellows in training. And the mentorship role has been the most rewarding aspect of my career. because it gives me opportunity to nurture the next generation of nursing professionals and researchers. The Vice Chancellor, I would like to mention that it was during my tenure as the acting head of Department of Nursing Science in 2009-2010 that we achieved a significant milestone of developing postgraduate programs in nursing. The program is focused in 5 specialty areas right now, but this can be expanded. Throughout my career, I've witnessed firsthand the challenges and opportunities that arise in this dynamic field. And in this lecture, I will be taking us through how community health nurses can effectively bridge the gap between academic knowledge and practical application using scholarly pursuits. We will examine the roles of community health nurses, and we will also look at the ways that a scholar has been able to influence the healthcare delivery. This image that we have seen here is to illustrate this topic. You can see a river there. This river that you can see is the current of public community health nursing. And you can see scholars that are paddling the boat. And then you can now see the tides of scholarship. So in this lecture, as an academic, we are going to see how scholarliness contributes to the field of public health nursing. The evolving healthcare ecosystem has underscored the vital role of public community health nursing in tackling the intricate health requirements of diverse populations. So this field is quite a dynamic field because it's not limited to the traditional roles that nurses perform. It's more embracing, it's holistic in nature, and it's using advocacy, education, community engagement to be able to foster wellness within communities. In this lecture, I will invite us to dwell into the world of public community health nursing. The impact of public community health nursing, it has been felt in society because it has shaped our society by empowering them. So I just want to draw our attention a little bit to the global situation of nursing. The global nursing workforce is approximately 27.9 million. These are made of professionals. So nursing actually constitutes the largest segment at 19.3 million, accounting for about 59% of all the health professionals. Even with that, there is a dire shortage of nurses globally, and that shortage is to the tune of 6 million. In Nigeria, we are producing for ourselves and we are also producing for outside. So we are grossly affected by that shortage. ICN has advised that training should be scaled up by 11%. But in our own country, we have decided that we are going to double that because we are not producing for ourselves. The infectious diseases like the one we witnessed during the pandemic also has significant effect on the workforce, leading to burnout and high attrition rates. So to fully leverage the potential of nurses in achieving the sustainable development goals, it is very necessary that investment be made into nursing. I will also just briefly look at the professional discipline of nursing, because for the past 30 years, that is what I have been engaged in, and collectively also in our department, that's what we have been engaged in. We have been building the discipline of nursing. A discipline is defined as a branch of knowledge. So what this implies is that nursing must have its own unique knowledge to be able to subsist as a discipline. And we have been able to achieve that through our numerous theories. It will interest you to know that this evolution of nursing into a discipline can be traced back to Florence Nightingale, the lady with the lamp. Nightingale's theoretical contribution laid the groundwork for the modern nursing education. So three broad things categorize nursing into a discipline. That is one, our perspective, the knowledge domain, as well as the goals of nursing. So these three areas, I will just take one of them, and which is the perspective. I would like us to reflect and know that nursing is a human science. And as a human science, it's considering the whole person. That's the body, the soul, the spirit. Not interested in just the problem that you have or the problem that you have come to a health facility. Is interested in knowing how you are reacting and responding to that problem. Nursing is also a practice-oriented discipline, which makes us very unique because we spend 24 hours at the bedside of the patient. And that is why nurses know a lot more about the patient than any of the other practitioners. Nursing is a caring discipline. All our interaction with the patient and with the client is influenced by our firm belief in caring. You can see that the nurse is smiling. There's a whole lot of communication, non-verbal communication that is going there to show that we care. Another perspective that we have is the health and wellness perspective. So this perspective shows that we are interested in all the dimensions of health, whether it's physical, mental, spiritual, environmental, social, emotional. So that means that whatever is the issue that you have, the nurse is always there for you. The nurse is always by your side, and the nurse is able to meet that need. This is talking about the definitions of health, and the various definitions, that of WHO capturing only three dimensions, that the physical and the social aspect, and also the mental aspect. Later in 1998, they added another dimension, which is the spiritual dimension. In one of the studies that we carried out among in a health facility, a rural health facility, we discovered that the patients were not going to the facility because they prefer to use the TBAs. And why do they do that? Because they say the TBAs prays with them. We as nurses, we believe in the spiritual dimension. So please, if you want us to pray with you, want us to read the scriptures with you, whatever it is you want in a spiritual dimension, we are always there to also provide it. So we should not abandon health facilities because the nurses and the healthcare workers are not looking at the spiritual dimension. There are many components of the nursing domain, mainly about our methods of assessment, our intervention strategies, our research methodology, and also our meta paradigm, which is made of the person, the nurse, the health, and environment. It will interest you to know that all the nursing theories, they have a definition for each of these. And health and wellness is what should particularly interest all of us because they have different definitions. And what that tells us is that we are able, because we are able to meet the multiple complex needs of our patients. So this is a figure of the discipline of not showing the various the components of that discipline, the domain as well as the goals. And that is what our department has been doing in these 30 years, developing this discipline. The topic talks about navigating the currents of public community health nursing. And it's good for us to just have an idea of what that really stands for. Public health nursing is a specialty field in its own right. And community health nursing, which is also known as community nursing, is also a branch of nursing focusing on promoting and preserving the health of populations within geographic community. What I have here is just to show us that, you know, probably when you saw public community health nursing, we don't be wondering why this double barrel. Is because the two terms, though they are similar, but they are not the same. They are different in terms of focus, in terms of scope, in terms of approach, in terms of level of practice, in terms of the geographical area that is covered, in terms of client focus, in terms of even the intervention level. Public health nursing is really wider. And while community health nursing is within a context, within a community context. The similarity of the university is that their priority and health promotion. So the current of public community health nursing focuses on a lot of it, and that is why it is described as a river. In this river, you have mental health, you have population health, you have chronic management of diseases, you have health literacy, technology integration, community-based participatory research, global health, climate change, rural health. So you can see that is really a river. So what are the roles of the public community health nursing? The roles can be grouped basically into three: client-oriented roles, then you have delivery-oriented roles, and population-oriented roles, still showing us that it is a river. So you can see the various roles that they play: health educator, health promoter, case manager, counselor, advocate, care coordinator, health assessor, case management, collaboration and partnership, and it goes on and on. So within that river, you have these multiple and complex roles, and you also have a lot of health issues. So that is why the topic says current of public community health nursing. So since as an academic, what we do in the nursing science is to navigate this this river with scholarliness. Scholarship and scholarliness will now be talked about. I would like to talk about them. The two are interconnected, but they are not the same. I will just go straight to look at a table that tells us about the definition. The scholarship refers to the act of conducting research and gathering knowledge and achieving the academic excellence. But scholarliness, which is our topic, it refers to the qualities, the traits, the values that distinguish a scholar, such as intellectual curiosity, critical thinking, and integrity. I opted for scholarliness because it is those values that we aim to develop in our students, so that they can use what they are getting from research to be able to influence the world in which they live. So scholarship, in terms of characteristics, definition is different, focus is different, scope different, the key skills are different, the values are different, and then the outcomes are also different. Let me just take the outcome. Outcome, for instance, is the production of research papers in scholarship, but in scholarliness, it leads to personal growth, intellectual development, and a commitment to make impact on the environment, in your field, in the life of others. So it is more suitable for us. The type of scholarliness, there are different types according to Boyle, different types of scholarliness, and you can see it in this diagram. You can see the different types of scholarliness. They are actually scholarliness of discovery. You have also scholarliness of integration, scholarliness of application, applying what you have learned in the real world. The integration is integrating the various aspects of your experience to be able to influence the community. And the last one is really a scholarship of teaching and learning. And all academics, we are engaging in that one. So my contribution is what I have titled Types of Scholarliness. So as I go into this contribution, I may request that you tell me the type of scholarliness that I'm engaging in, whether it's teaching and learning, or it's application, or it is integration, or it is just discovery, in which case you are just discovering new knowledge. So these are the key areas of my research. These are the key themes of my research: health education and promotion, nursing excellence and education, public health priorities, mental health well-being, and menstrual hygiene management. Although when I reviewed my work, I found that I have contributed and have been impactful in the area of health education strategies and implementing it in real life. Also, I have been able to assess nursing student attitudes and perceptions of caring behaviors, and also the job satisfaction among nurses in private and public hospitals. So I've made some contribution in the area of nursing excellence and education. I've also done some work in public health priorities, namely HIV, AIDS, diarrhea disease, malaria control, cervical cancer screening, and mental health and well-being. I'm going to go into some of the key areas that I have worked in, some of the teams, so that I can bring up practical illustration for us as an audience. So this study, we did a study on stress. This study on stress was a multi-country study. It took place in the Philippines, Greece, and Nigeria. And we made a lot of findings. Some of the findings that we made was that we found that that stress is culturally defined. How stress is perceived in Nigeria is not how it's perceived in Greece or in the Philippines. And even with respect to coping strategies, they use different coping strategies based on their background. We also found that age, those who are advanced in age are able to use more coping strategies than the younger ones. Then in terms of level of education, we find that those who are in the higher level, so maybe 400, 500 level, they are able to use better coping strategies and adapt more easily. So the implication of this is that we should, because we are all engaged in teaching students one way or the other. Even at home, we still teach. Even parents are also involved in this. It's just to know that students, they experience stress. And it's been well documented all over the world that nursing students in particular, they experience a higher level of stress than others. And I'm sure that yes, because while other students are only exposed to theoretical knowledge, our students have to go to the practice area. And for nursing, our program is so loaded. We are producing general nurses, we are producing midwives, and recently we started producing public health nursing, in addition to the Bachelor of Nursing science that we get. So you can see the level of stress. So what do we do? So when the students are coming in, they need to go through some training so that they will know what the stressors to expect, and also strategies that they will use to cope with it. This is similar to the findings in the other countries. So it's not a Nigeria local thing. So this stress thing cut across other countries as well. So this is a second study that I did. This was really for my PhD. We looked at, it's a study on workplace educational intervention for blood-borne pathogen. It's an intervention study. So what we really did was to go and get a baseline to know what the nurses know about hazard, safety, the level of training, and then COLAB was very impactful because there was improvement in the knowledge of the nurses, and from 27% to 97.6%. Even safety practices have gone up from 13.1 to 21.9, and then percutaneous injuries that they were sustaining has also decreased. Nurses can carry out intervention for you, because we already have a lot of experience in this, and we have been able to obtain a high level of success. So we also did another study. This study is actually an intervention study. This was the study where we had the TED Fund grant. So this study, we did a baseline. So part of what I'm going to share with us is just the baseline. So at baseline, we discovered that children, that secondary school children, we did this study among 1,006 secondary students, both in rural and urban, as well as in private and public schools. We found that students, they were absenting themselves from school. And why were they doing so? They were doing so because they were being ridiculed, because they will say because of the menstrual issue, sometimes they stain their dress, sometimes, you know, the aroma coming from them is not too good. So others stigmatize them. We also found out that many students were unable to afford the sanitary towels, maybe because of the socioeconomic status of their parents. And then there's a cultural misconception about menstruation, which is that it is a disease. Rather than looking at it as a physiological response, they are looking at it as a disease, because people are always feeling tired, feeling weak, and feeling some pain. So they must be sick. So we had to now do an intervention to correct those misconceptions. So one of the things that we also discovered, because we look at knowledge of the adolescents in these schools, and we found that there was disparity between the students in the rural area and in the urban centers. And their main source of information were mothers. Please, can we just put our hands together for all the mothers that are here, that are playing their role? Please, you want to encourage you that you should do more. Prepare your children for menarche and prepare them for menstruation, and also prepare them to manage that menstruation. And for those of us who may be proprietors of schools or related to them, we should encourage them to have gender-sensitive toilets, because one of the reasons why the girls don't go to school, they say they cannot be using the same toilet facility with the boys. And in most cases, they didn't even have a place to dispose the towels, the used towels, and the girls, they don't want to go and keep it with the other waste. So these are things that we can take home if we have a school. If we are keeping children in school, we should encourage that they should provide gender-sensitive toilet for the girls, for the sake of the girls, so that they will not be running away from school. Because menstruation is not a sickness, it's not a disease, it's a physiological reaction. So I'm going to now go on to the other the other, okay, this one that I've talked about, where does it fall into? Which type of scholarship? Which type? Sadi, which type? It's not on the board though. Is it discovery, or is it integration, or is it application, or is it teaching and learning? Which one? Application. Good. Clap for yourself. You are a very good student. Now I would like to go into the other scholarship that I have been involved in. This Sigma Theta Tau associations that have really been very helpful. Sigma is very, very good because you can, in fact, most of my collaborative work, I was able to do it through Sigma. In fact, most of the time they have to pay because when they come up, those journals that are costing $2,000, $3,000, that collaboration really helps. Another collaboration that I have been able to help us to be involved in is also NANDA. Okay, so this study that is here is really about mothers in RT units. So we also evaluated, the program was already in place just to evaluate, can mothers pick up information even though they are distressed? Their baby is ill and they have come to the hospital. Can they pick up simple information while they are there? And we discovered that yes, they could pick up information when they are there. So what we do is to empower them so that they don't keep coming with diarrhea. They know what to do when their child has diarrhea. Teach them how to prepare the salt sugar solution. And I say for all mothers that is here, the primary healthcare approach is that you should be able to do something before you come to the hospital. But doing the right thing is very important. And that's where the public community health nurse comes in. They give you the information that you need, the correct one, to empower you to take action before you come to the hospital. Professor Olaide, there's Nursing Education Supportive Initiative. When I was HOD, I was privileged to have an encounter with a nursing student who came in. She was really worn out. She said, I have headache, I have running tummy. In fact, what else was wrong with her? She's very weak. She's very tired. So I said, okay, let us counsel her. When we counsel her, we discovered that her real problem was that she could not pay her school fees. And so every other thing is wrong with her. So that is what motivated me to start this scholarship fund from 2009. At that time, our former Vice Chancellor, Professor James Efoke, was the VC. He kindly and who identifies them? It is NONSA. NONSA is our Nursing Student Association because they interact with the students, so they know who has the needs. I'm sure some of the beneficiaries are here in the hall and they are doing well. So talking about, I've also engaged in this scholarship of workshops and conferences, been able to organize some conferences at the lead person, the West African College of Postgraduate Nursing and Midwifery Workshop of 2014, the NANDA. NANDA is a synonym of our standardized nursing language. So we did it right here on campus. We were supported by management. And then when I went on sabbatical to Lagos, I also had one done at LASUCOM. So the objective is to build capacity of clinicians as well as scholars. Then clinical research workshop was also organized in 2022, where in collaboration with University of Oxford, UK, they funded it fully, and the aim was to establish a global research network for Cross River State. The network is existing, and whenever funding is available, they are now in a position to apply for funding. The strategic alliances, I've mentioned some of them earlier. Well, in addition to that one, I've been able to participate in a co-creation workshop by the School of Tropical Medicine, Johnson & Johnson, under the auspices of the Nursing and Midwifery Council of Nigeria. So this opened up an opportunity for our nurses, our midwife educators in the whole of Cross River State to now be trained in competency-based training in emergency care. So then in terms of mentorship and supervision, I've been able in a modest way, 500 undergraduates, 20 postgraduate students. Then I've supervised students from various institutions, CALABAR, University of Ibadan, even the asset in Port Harcourt, Garden City, University of Ghana. One of my MSc students was linked to a grant, and she was able to get it to do a master's program. Then recently, a PhD Department of Nursing have been doing that. We've had very successful outings. The first one, we had 95.5% pass. The second one, we were able to have 100%. Okay. So during the when I was deputy dean, there were a few modest achievements there. The STEAM mentorship, health screening, master's program. I'll just make a few recommendations and then go on to the acknowledgement. So in terms of shortage, we are really short of public community nursing persons in our department, manpower. We really need to build on manpower. The achievement we've had is been through collaboration with other sister institutions in the state. Even we are really short there. Then also fostering a supportive work environment, also very, very important because of that study that we did. Then promotion of the use of oral rehydration therapy among mothers. Then I would like to talk about investing in nursing education and training. It is quite rewarding. And one of the investments that we are looking at from the University of Calabar is to migrate us to a faculty, not just by mouth, but we want it in real terms, because this public community health nursing that we are talking about, we can split it into different specialties. We can have masters in public health nursing on its own, community health nursing on its own, home healthcare on its own, occupational health nursing. In fact, the various aspects, it can be expanded, and it can only happen if they invest in us. I hope they will invest in us. I wholeheartedly acknowledgement. I want to acknowledge that God has been my constant helper and guide throughout my life journey. I also want to appreciate my loving parents for their sacrifices. And my mother in particular, she was the one that took me to Lagos and helped me to take those exams. My father on his own, though late, he really made all the effort to make sure that all of us went to school. This was a time when there is male preference for going to school, but he didn't believe in that. So he gave equal opportunity, and that is really good. We have lost 2 siblings to death, and that's late Mr. Shegun Dada and late Mrs. Olabisi Alademere. May their gentle souls rest in perfect peace. I would like to express my deepest gratitude to my beloved husband, Dr. Edet, affectionately known as Young Man. Young Man, please, can you rise up and wave? I celebrate Dr. Edet as a devoted husband of one wife, a responsible and loving father, a shining example of a decentralized Nigeria. Thank you, my darling husband, for being my safe haven, my confidant, my partner in every sense of the word. I would like to express our heartfelt appreciation to our adorable children. They have been very supportive. They encouraged me to come to this podium, and they have really been standing firm in challenging time in the faith that we handed over to them. I've mentioned their name earlier. I'm very proud of each and every one of them. I'm especially thrilled to have raised a dedicated professional nurse who will continue this legacy. Mrs. Alice Pastor Nurse, please can you just rise up and wave to everybody? I want to extend my appreciation to my loving family members. They have been wonderful. My sisters, my brothers. If you have a copy of the book, you will see that you will see a lot of the acknowledgement that is there. And I would like to put on that although Senate has advised that we sell the book at 1,000 naira, but a member of the family decided to sponsor it 50%. and that's why you are having it at 500 naira. I am grateful to His Excellency Babajide Sanwo-Olu, the Governor of Lagos State, for appointing me as chairman of the Governing Council, Lagos State College of Nursing in 2023. That has given me a whole lot of opportunity to continue my passion in mentorship. I acknowledge the visionary leadership of Professor Florence Banku-Obi, the 11th Vice Chancellor of the University of Calabar. She has been unwavering in her commitment to academic excellence, and that is what has created this space for me to be able to stand. Madam, we celebrate you. Thank you for all that you do. I want to also appreciate my supervisors at the PhD level, Professor Asuzu, Bamidele, and Dr. Ofi, and all my friends in Ibadan and colleagues in Ibadan. I know that many of them have logged on online. I want to appreciate Professor Essien, the former VC of University of York. He gave me my reference letter. I appreciate my friends, Professor Patrick Asupo and Professor Mrs. Anne Asupo, for their tons of friendship, support, and encouragement to do this lecture. All my colleagues, Department of Nursing, in the Faculty of Allied Medical Sciences, even across the college, who have come to grace this occasion, I really appreciate you. I must just mention my HOD. I'm thankful. The chairman of my planning committee, Dr. Ekaite Asuko, I'm very grateful. To my research team members, and I'm sure some of them are here, please, Dr. Ekaite Asuko is one of them, Dr. Idan Ojo, Professor Samson Akpan, Dr. Philip Bassi, my citation reader, Professor Esedumon, Dr. Edet, Dr. Akanidio, Mr. Matthias, and Dr. Nwanko. Please, if you are here, can you just please stand up for recognition? I'm very grateful to you. Thank you. I appreciate my international collaborator, that's Dr. Leodoro Lambra. We have worked together for many years, and I appreciate our team spirit. So with profound gratitude, I want to acknowledge the numerous men and women of God that have been instrumental in shaping my life journey. I want to appreciate the prelate of the Presbyterian Church of Nigeria, His Eminence Epeyon Uyo Apanika. Thank you for being a beacon of inspiration. I also want to thank all our other pillars in the church and my other spiritual mentors that are either here or even outside here. But I must mention my minister in charge. Please, our minister in charge, Dukestown Cathedral, can you please stand up for recognition? I appreciate you, and I appreciate your mentorship. I know that there are so many persons that are here that I cannot acknowledge just because I'm really limited by time. But I'm thankful to the session of Dukestown Church, the Women Guild, Onward Women! Onward Women! Thank you so much for your support. I want to appreciate my brother and my sister, Engineer Mrs. P.U. Bassi, for their unwavering support. I thank my family union, Dada Descendants Union, and also Ituokonitu Union, my dear in-law. They have been very, very supportive. I will miss this out if I don't mention Auntie Professor Ekanem Ikibrid. I call that she's in Tanzania. I'm sure she's joining online. I also want to thank Professor Stella Ekpe for her editorial work, Associate Professor Barrister Lionel Efio for contextualizing my citation. My colleagues in ASU Praise, are you here? Okay, thank you very much for your resilience. It has always kept me going. So finally, I extend my heartfelt gratitude to all the attendees of this lecture, both those who are attending face-to-face and those who have decided to hook in online. Please put your hands together for yourself. You have done well. You have done well by coming. So I'm also indebted to the technical crew, the PRO's office, development division, for their support. They were always on my case. You have to bring this now. You have to do this. So my friends, your steadfast support has been my pillar of strength. To well-wishers, your encouragement has propelled me forward. To my fans, your enthusiasm continue to inspire me daily. To my critics, your feedback has been invaluable to my growth. Each of you, friends, well-wisher, fans, critics, you have played vital role in shaping my journey. From the depths of my heart, thank you all for being an integral part of this experience and for your unwavering support all along the way. I would like to end by saying, praise the Lord. All right, thank you.
Congratulations, ma. Please, you can sit. Be seated. Bridging the river, navigating the currents of public community health. Public community health nursing on the tides of scholarliness. The title makes you wonder. Are we talking about the river or we're talking about nursing? But I think we have a better understanding. Please, let's give her another standing ovation. Thank you, ma. God bless you for teaching us this evening. God bless you, ma. She said, the nurse is always there for you and always there to meet your multiple complex needs. Is it true? I knew the area the answer would come from. Even in the spiritual dimension, the nurses are there for you too. I heard that too. And I'm also a living testimony. I've also benefited from that. God bless you. Though not from her, from another nurse. But there is a question I want us to go home with. She said nursing students actually go through more stress. I didn't ask for an answer. I said a question for us to go home with. She's throwing out another research question that will lead to further research. Give your research work a topic so we can all do further research. Thank you, ma. God bless you richly. And I add there, in Jesus' name. Because she blessed us in Jesus' name, we bless you also in Jesus' name. Amen. Without waste of time, ladies and gentlemen, permit me to invite again the chairman of this occasion, represented by our DVC, to step forward for presentation of the lecture notes by the inaugural lecturer and also appreciation of the lecturer by the exchange of momentum.
Okay. The inaugural lecture is done and dusted. I am no longer a debtor to University of Calabar. It is my pleasure to present a copy of this inaugural lecture to the representative of our Vice Chancellor, Professor Florence Bankobi, on the occasion of the 131st 131 inaugural lecture. Thank you, ma'am. In addition to that, the family has decided that we are going to present an instrument cupboard to our young public health nursing laboratory. And it's going to be chipped in from Lagos. It's just at a cost of 250,000. Thank you.
It is indeed our delight to have our 131st inaugural lecturer here.
What is it, ma'am?
Has done us the honor to present to us what she has done over the years. She has paid her debt, and the university management is presenting her with this memento for keeps, and for her to show up that she has paid her debt. So,
Gently,
the management of the University of Calabar, send this memento to you, Professor Olaide, Bamidele, Edet, as the 131st lecturer of the University of Calabar. Congratulations.
Let me at this point invite the Chairman, Committee of Deans, Professor Ekaitena, to give a vote of thanks.
The Vice Chancellor and Chairman of this gathering, here Professor Florence Bankobi, here ably represented by our very beloved Deputy Vice Chancellor, Academic. Please permit me to stand on the existing protocol to deliver this vote of thanks. First of all, I want to thank the Almighty God for always granting us this unique opportunity to sit here and be taught by our colleagues. I appreciate the 131st inaugural lecturer, our beloved Professor Olaide Bamidele Edet, for dishing out that very well-prepared meal. Growing up, I knew the river to be a natural body of water that empties into a bigger body of water. But today, I will leave here with a better definition of the river, that the public and community health nursing is also a river. And you will agree with me that she took us through the components of that river. Don't go there looking for fish because you won't find one. We also appreciate the fact that in the course of the lecture, she mentioned to us that the practice of nursing is holistic. Please, when next you go to the hospital, stay in your ward and receive all the treatment, because even the nurse is also there to pray for you. Don't go looking for prayer house to the detriment of your health. Having said that, I want to appreciate our beloved Vice Chancellor for always giving us this opportunity to gather. Thank you, ma'am. We appreciate you. I appreciate the Provost College of Medical Sciences and, the Deputy Vice Chancellor and other members of the core management team are here. Just this morning, we're out there receiving people that were turning in their exit report. So you'll agree with me that it's a huge sacrifice to be here. We appreciate you, sir, and the registrar too. We appreciate the provost of the College of Medical Sciences and the deans and directors of institute, especially the dean of the Faculty of Allied Medical Sciences. In a row, very quick succession, he has turned out 2 inaugural lecturers. Can we give him a round of applause? And we appreciate the head of department of nursing science and members of of the person of our beloved professor. We appreciate also the staff of the development division of the registry. We appreciate the staff of the information unit of the registry. We appreciate the media people in the house for packaging and also helping us to deliver this inaugural lecture. Turning to this side again today, we see the family of the inaugural lecturer. We appreciate you, sir, for the gifts of Professor Olaide to the University of Calabar. We appreciate the prelates and the moderator of the General Assembly of the Presbyterian Church and all ministers of the gospel here present. Thank you for coming. We appreciate you. And then to our beloved students here present, especially the students of the Department of Nursing, we are feeling you. Great Malabites and Malabraces, we appreciate you. Thank you so much for calling. I want to make a remark while I carefully left this to the end. I appreciate all academics in Rome. Please, thank you for coming and choosing to rope for our beloved professor. You have just added color to this event, and the Lord will bless you. Thank you, everybody. We pray that as you go home, that the Lord will grant you journey mercies back home in Jesus' name.
We have gradually come to the end of this event, and I want to call on the chairman of this occasion, again represented by our own beloved DVC academics, to make her closing remarks.
The principal officers of the university, our provost and deans, the chairman of the committee of deans, please permit me to stand on already established protocol. Our university has done it again in having one of us present this 131st inaugural lecture, indicating the contribution of this university, the well-being of the community at large. We thank the Department of Nursing for giving us the 131st inaugural lecturer. She has paid her debt, and today she is a professor with
capital P. I thought you would clap for that. It certainly doesn't come easy. It shows you that indeed she has waded the tide and the rivers, and she has bridged every body of water to make it here. Please, another round of applause for her. One of the things I have learned here personally is that the elders cope better with stress. I didn't know that. I thought the younger ones would cope better. And our public health nurse has told us that the elders are coping better. Then please don't put more stress on them. Nigeria has done enough. So we thank you for your contribution in knowledge. And I want to announce that we are gathering again next week by the same time for the 132nd inaugural lecture by our own Professor Basi Edet of Geography and Environmental Studies. I look forward to seeing every one of you here. If you have learned one or two things, you certainly will learn another. So please keep it a date with us.
Thank you so much. Can we give the representative of the Vice Chancellor a resounding applause? Thank you so much. Just like she just said, I've come to the end of a photograph. After a snapshot with the inaugural lecturer's husband, you'll take a snapshot with them. Every other photograph will be outside the auditorium, just like the representative of the Vice Chancellor just said. We will be having our last inaugural lecture for the year next week, Wednesday, 18th December 2024. And this is going to be presented by Professor Basi. Is he here? Please, can he stand up for recognition? That is our Prof, former CES Director. Please put your hands together for him. You're welcome, sir. So please, that will be the last lecture for this year. Same time, same venue. Please, you're all invited. Thank you so much. As we please rise to take the university. Okay, we'll take the group photograph first. While they are down there, we'll take the University of Calabar. So please, members of the high table, please don't leave the hall, please. There will be a recession. The recession will be in a reverse order. Members of the high table, take the lead. Please don't leave the hall. Just be standing and remain where you are. Thank you so much. Members of the Presbyterian Church of Nigeria, please, you're all recognized and you're welcome once again. Please stand up. Be where you are. Don't leave your position. Please, just remain where you are. Please, thank you so much. Do not leave the hall. Thank you. Do not leave the hall. Thank you so much. No, we are not done yet. Thank you so much. Do not leave the hall, just remain where you are. We'll take the University of Calabar song, and after which we'll have a recession. Thank you so much. Please, we are not done. Can we have the inaugural lecturer's husband join them in a group photograph? Inaugural lecturer's husband, please remain where you are, please. Please do not leave the hall. Thank you, please. I beg us, please don't leave the hall. Thank you so much. Can we take the University of Calabar song? Please remain where you are. Thank you so much.
Need the broad expanse of Nigeria, I stand to school with a vision bright, ever holding the banner. I bring the hope of the mind, all your we have come to get apart, to unite in battle, we will work to we are quest for a living day. We will have it purpose to serve mankind. In the very soul that's our for you. All we have come to live hard, so unite in battle, we will work to mighty God, let the wisdom in us all blow. We the knowledge we are thankful. God is beyond what all we have come to live by, so united by the heart, we work to University of God.
Thank you so much. Please remain where you are. Recession is about to commence. In the reverse order, members of the high table, please take the lead, clear the aisle, and let the entrance be free. Thank you so much. And after which, all professors that are roped follow suit. Please remain where you are. Don't block the entrance and clear the aisle. Thank you so much.